Alright, so I'm Brian and we're going to be testing for the cranial nerve responses. Okay, so for cranial nerve number 1 is the olfactory nerve. And we're just testing for normal response and being able to distinguish the two smells between coffee and cold. So Nelson, if I could ask you to close one nostril. Good. Close your eyes. Let me know what this is. Next one. So switch sides.
But when I go to my email and open up segments, it does let me open it.
Good. Okay, so the next one, cranial nerve number 2 is the optic nerve. And a normal response for this one is that the pupils normally constrict when I flash a light through it. Okay, so next.
Hi, my name is Martins, and I'm going to be testing you just start off with cranial nerve 1, which is the olfactory. So I'm going to have my patient close their eyes.
Okay, so the next one is the trochlear nerve, which is cranial nerve number 3. And this tests for the symmetry of the eyes. I'm just going to ask the patient to look forward. Look forward and motion. So his eyes seem symmetrical. Okay, so cranial nerve number 4 is trochlear nerve. And basically I'm going to ask the patient to follow this pen. And then we're just checking to see if the patient's eyes move in and then out. Okay, so if you just follow the pen for me.
Cool.
Good.
Yeah, if you can either...
Okay, so next one is the cranial nerve number 5, and this is the trigeminal nerve. And I'm just going to ask the patient to see if he can distinguish whether it's a dull side or a sharp side. And a normal response for this is to be able to distinguish if it's a dull side or a sharp side. Okay, so I'm going to be asking the patient to close his eyes. And then we're going to touch his forehead, his cheek, and his chin. So what side is that? Dull. Okay, this one. Okay, good. How about this? How about this? Good. How about this one? This one? Okay, so you got those ones right. Alright, so the next one is the facial nerve. Cranial nerve number 6 is the facial nerve, and it's the abducens. Cranial nerve number 6 is the abducens. And that's just testing to see if the patient can look forward. Okay, so just look at my chin. Okay, good. So eyes are symmetrical. We're just looking for symmetry of the eyes. Alright, so cranial nerve number 7 is the facial nerve. And it's just testing if the patient could do the desired task. Okay, so could I just ask you to raise your eyebrows? Good. Close your eyes. And then smile for me. And then puff your cheeks. Good. Okay, so the next nerve is the vestibulocochlear nerve, which is cranial nerve number 8. And that just tests again if the patient could look at the chin, we're just looking forward without moving the eyes. Okay, so if you just look at my chin again. Okay, good. Okay, cranial nerve number 9 is the glossopharyngeal, and that just tests for the soft palate to see if it'll elevate or if it gets.
I'm going to do some SEM first. And then
So look at me.
after you sit up again.
And do side to side just so that...
Okay, so I saw elevation and a soft palate, so that is normal. Alright, so cranial nerve number 10 is the vagus nerve, and as a normal response, the patient's soft palate will rise, and I'll just ask the patient to say and you would look, and there's an elevation in the soft palate. Okay, so cranial nerve number 11 is the accessory nerve, and that's a manual muscle test for the sternocleidomastoid and the upper traps. And the normal response would be the normal strength of those muscles. Okay, so for sternocleidomastoid, just, I want you to turn your head and then just forward flex into my hand.
Alright, so olfactory.
Good. And then manual muscle test.
Yeah, I use
Shoulders, so just shrug your shoulders upwards.
So I'm just gonna put this back. Oh yeah, you're
So they're normal strengths on there. Okay, so the final cranial nerve number 12 is hypoglossal, and the test is the symmetry of the tongue in the midline. So if I just ask you to stick your tongue out,
cranial nerve 1, which is olfactory.
and his tongue is in the middle, so that's normal response.
Close their eyes.